welcome back. It is your feel-good breakfast show, Expresso on SABC3, and that time of a Tuesday where we get to hang out with Dr. Darren Green for our medical chat. And today we're focusing on a medical issue that faces 1 in every 42 women. We're talking about cervical cancer. And of course, we welcome your calls for questions and comments on 083-9133-728. On the line right now, Kagiso calling us in from the Free State. Good morning.
Yo, Kathy, how are you, sir?
Kim na doing up, boy?
I give me sharp, man.
Hey, Tara, what is your question or your comment to the doctor?
My man, I'd like to ask the doctor about the cervical cancer. Man, my mom died on May this year.
Oh,
but in 2010, my mom went to Bloemfontein in that cancer for the hospital of cancer. The doctor said they've taken it out of her. But suddenly, my man, I don't know, this year, suddenly it attacks her and she passed away. So I want to ask the doctor, what's happening if the doctor said they've taken cancer away, but suddenly it's coming back again? What causes that, actually?
That's a great question.
Dr.
Darren, let's try and touch on that a little bit. Just kind of, expanding on the complexities of cancer as a disease.
For sure. So understanding how cancer is graded and how it's treated is very important. And we grade cancer basically by looking at whether it's actually just involving a local area and limited to a local area, how big that area is, whether it's broken into the bloodstream as well, and those cancer cells can then spread via the bloodstream or via the lymphatic system, drainage system, to regional lymph nodes, and then whether from the regional lymph nodes it can then even move to other parts of the body, like the lungs and the liver, etc.
Yeah.
So in this case, it would be very interesting to know what the grade of the cancer was, and obviously the treatment plan is then designed around that. If, as I said earlier, if it's far developed in terms of the cancer being stage 3 with metastatic disease, which is spread, then, for example, chemo and radiotherapy is actually the treatment of choice.
Kagiso was referring to the removal of the cancer.
So she had a hysterectomy or a surgery, obviously, a radical hysterectomy. So there might have been, obviously, cells then that seeded in the bloodstream and then manifested later on, or the cause of death might not have been related to the cervical cancer, but something else in a comorbid condition. Often if you have cancer, you have an increased risk of dying of things like a pulmonary embolus, which is a clot that can form in the blood vessels and then shoot to the lung, and it's quite rapid and quite quick, especially if it was such a quick, progressive, unannounced thing. So the exact cause as to why his mom passed away is something that, can be associated with risk factors around having cancer or the cancer itself.
Yeah, I think we forget how fragile we sometimes are, hey, as human beings. Kagiso, thank you so much for your question, and of course we're very, very sorry for your loss as well. Dr. Darren Green, I want to ask you about HPV.
Sure.
What exactly is it, and how do we get it?
So it's a virus, like HIV, like herpes simplex, etc. It's called a human papilloma, and papilloma refers to like a cauliflower. A cauliflower looks like an exploding cloud of smoke, really. And the papilloma virus, obviously, when you look at it under a microscope, looks like a typical virus. It's round with a whole lot of triangles around it in its protein structure. The long of the short is the virus, the different subtypes. You get some that are associated with throat and mouth and oral cancers. And then you get others that are associated with genital warts, which is one of the clinical manifestations that you will know of, that you have the virus, that you can do something about in terms of taking the vaccine, but also having the warts removed. And then obviously you need to understand that in some subtypes are actually cleared by your own immune system. Others obviously then go on and progress to affect the skin cells that we were talking about at the level of the cervix. How you get it is contact with the genital area. So all forms of intercourse in terms of oral, etc. as well, are all implicated. So you get cancers of the mouth, the throat, the anus, and the vulvovaginal areas, and that's important also to know about.
So sexual contact, is that the only means by which this disease can be transmitted?
Correct, but if you think about a baby being born and having contact as it exits the birth canal with genital warts and HPV that's colonized the birth canal, for example, there's a contact already there as well. So people need to understand that.
Can we touch on vaccination?
Yes.
Is it possible to be vaccinated, and what can you expect from this treatment? Are there side effects? Is your body going to be feeling any different when you're undergoing this kind of treatment?
Good. So besides having a bit of a local reaction to the vaccination site, as most vaccinations, you will then have side effects of being a little bit red and swollen around the injection site. It's normally a series of 3 injections. And, we have 2 available vaccines in South Africa. One of them, Gardasil, covers all the subtypes of HPV. Cervarix covers only certain ones. So you need to understand that. So a series of 3 injections over a period of 6 months. So you get 1 and then 1 month or 3 later on, and then 1 at 6 months as well.
Yeah.
And then obviously it's a cost. It's quite a costly exercise, but now it's been implemented in our schools through the department, and it's been given at schools from girls after the age of 9 or 10 years old already. And the benefits are, even taking it later on in life, are that it reduces the incidence of genital warts, as has been represented with one of the latest studies in Australia.
Sure, this is some good stuff. But I do want to talk about pap smears a little bit later on. But we've got Kathy on the line right now. Kathy from Jeffreys Bay. Good morning. How are you?
Good morning. I'm well, thanks. How are you?
We're very, very good. Thank you so much, Kathy. What is your question or comment for Dr. Darren Green?
I want to ask the doctor. My granddaughter received the vaccination when she was 10 years old, and she had 2 vaccinations, and now her hair is starting falling out. And I went to my gynae and I asked her, and she looked on the internet, and she said it could be that is the cause of the vaccination. And she went to a dermatologist. The dermatologist gave her treatment, but nothing is helping. Her hair is falling out as if she's getting leukopenia. So we are very worried. Is that the cause of the vaccination? Because she had 2 doses. She's at her father's school where he's teaching in Kimberley.
Sure.
So certainly hair loss is not documented as a major side effect of the vaccine. There are, however, many other things that need to be considered here. There are autoimmune causes. There's simple things like even a thyroid condition that can lead to a loss of hair. By far, the benefits outweigh the risks in this case. I'm glad to hear she had it at the right age. But the condition that she's suffering from, I think she's referring to alopecia, which is obviously a lack of hair growth specifically, where the hair follicles themselves are actually attacked and die off due to an autoimmune-mediated process. And also a very difficult condition to treat. So often they'll go and look at the skin cells of that area and look at, are there any hair follicles present or not? Or is it just a hormonal side effect, secondary to that? And I think that's what's important in this case.
So you're saying in this regard it can't have anything to do with...
No, I'm saying that it's unlikely that the vaccination itself is causing all this hair loss. I think they must also look at a few other systemic common causes in that age group that can also cause hair loss, and not look at only the association in time of the vaccine.
Well, because it happened just 3 months after the hair loss.
I see.
Well, Kathy, thank you so much for the call.
3 months after vaccination, she started getting the hair loss, and she's now in treatment, and she's going to be 13 next month.
So before we close off the call, what can Kathy do right now, Doctor?
Yeah, so I think the first thing to do would obviously be to quantify the hair loss. She needs, and what the dermatologists actually do is they actually look at the density of the amount of hair follicles per square surface area on the scalp, for example. And that needs to be looked at. I'm glad to know that she's following up rigorously with the gynae as well. So all that she can do at this stage is actually monitor, because remember that once the vaccine is actually in place, because when they give you the vaccine, it's not the actual infection of HPV, it's just the protein particle. It's not the viral DNA of the vaccine, of the particle at all, of the virus. And then your immune system responds to that protein, and that's what leads then to the immunity. So I would recommend that you definitely carries on following up with the gynae, and that we monitor it with time. After 6 months, obviously, the vaccine is done. Then we'd like to see what happens and to see if there's an improvement in her condition.
I do want to ask you, however, about pap smears. How exactly does that work? I think we have like a few more seconds in this one segment.
Quick take-home messages. You need to consider having a pap smear. If you're sexually active before the age of 21, then certainly consider having a pap smear to have a look at that transitional zone. And then, of course, after the age of 21, every 3 years is what the recommended guidelines are.
Okay.
And that's important. It's normally a 2-minute process that you need to be prepped on. You need to be comfortable with the person that's doing it. You need to ask as many questions as you can about privacy and how it's done, and also what to expect from the results. And know that you're being proactive. Know that you're doing it for your family. Know that you're doing it for your, you know, for your future in terms of your ability to even bear children. And you know, cervix cancer affects all classes, all ages, and that's what people need to understand.
You mentioned that there's a little bit of uncomfortability because naturally it's a very intimate thing, but I don't think in this regard that ignorance is bliss.
No, definitely not. And certainly the benefit of having your pap smears done on time far outweighs the risks of that. But, you know, the sensitivity that must be dealt with that. It's the same with men that have prostate screens. In ladies, for example, with the pap smear is never a pleasant experience, but it certainly is one that's necessary.
Definitely necessary.
Well, thank you so much, Dr. Darren, for being here. We're going to keep the doctor here and also keep our lines open on 0839133728. You can give us a call with any comments or any questions. We do appreciate those that have called before, but there's still lots more to come on your Feel Good Breakfast show.